This is your hip joint. It is made up of the top of your thigh bone called the femur and your pelvic bone that forms a socket called the acetabulum. The top of your femur is shaped like a ball, and below that ball is what's called the femoral neck. And this is how you have a ball and socket joint in your hip. Unlike in the shoulder, the socket of your hip surrounds about 30 to 40% of the ball. So it's much more constrained by the bony anatomy and usually much more stable. You have several ligaments that stabilize the hip, and these run in what's called the capsule of your hip joint. There's a structure inside the joint called the labrum that surrounds the rim of your socket. It creates a seal around the top of the ball and traps fluid in the joint, which helps lubricate and protect the cartilage. The labrum can frequently be torn in cases of hip impingement. In those cases, you can also have extra bone in other places of your hip at the junction between the ball and the neck in this region, and below this bony prominence called the inferior iliac spine. In those cases, the bone on the femoral side hits the bone on below the subspine and can pinch the soft tissue structures in between, hence the name femoral acetabular impingement. Like in other parts of your body, you have bursas, which are thin sacs of fluid that cushion skin or muscles as they glide over or under bony prominences. One of the biggest ones in the hip is called the trochanteric bursa because it sits above this part of the femur bone called the greater trochanter. Sometimes the bursa can be inflamed or swollen, causing pain on the outside of your hip. What's not shown on this model are several muscles that surround the hip. Some of the most powerful muscles in your body are called the hip abductors. They attach to the rim of the pelvic bone here down to the greater trochanter and are called the gluteus medius and minimus. Sometimes you can have tears of those tendons as they insert on the greater trochanter. That would be similar to a rotator cuff tear in your shoulder. A large muscle that forms in this part of your pelvis goes over the front of the socket and attaches down here to what's called the lesser trochanter. That's called the iliopsoas muscle. And then you have the gluteus muscles that attach the backside of the pelvic bone to the top of your femur bone. Hopefully this demonstration has helped you to understand your hip anatomy more, but you can always refer to our website for more information.